Oh, let's.
Is John on the meeting?
Yes, sir.
Okay, I just want to make sure. Thanks, John.
You bet.
Mr. Chairman, we are ready to go.
All right, thanks, Stephen. All right, it is 6:01 p.m. on Monday, May the 4th, and we're now starting a special call meeting. And I'll ask Matt Rice if he will to lead us in our invocation.
Pray with me. God, we just want to ask your blessings on our meeting tonight. We pray that you'll give us wisdom to make good decisions for our community, for the employees of the county. And we just ask that you keep your hand of protection on our community and help us as we go through the pandemic, and pray that you'll spare us from this. And we just pray for all those who may have loved ones or know people who are sick. We just pray for healing. And again, we just ask for your wisdom in all the business that we conduct here tonight. In Jesus' name, amen.
Thank you, Matt. At this time, I'd like to ask Jason Harris if he will lead us in our pledge to the flag.
Everybody stand. I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, liberty, justice for all.
Thank you, Jason. Ms. Bowen, when you're ready, please call the roll.
Jamie Harris,
Here.
Jason Harris,
Here.
Stephen Hendricks,
Here.
John Mosley,
Here.
Marie Rice,
Here.
Matthew Rice,
Here.
Lauren Thomas,
Here.
Glenn White, Todd Wilcox, Todd Wilcox. 7 present, 2 absent.
Thank you, Ms. Bowen. Item 4 on our agenda is the consideration of moving employee group health insurance to the state plan from Blue Cross and Blue Shield, and I'll recognize John Manfull at this time.
Lauren, thank you. Appreciate everybody taking the time to meet tonight. Again, in a special called session. Again, I just want to just basically say, again, the county, you all as decision makers have done a great job in the benefits that have been offered to the county employees, giving them selections, giving them options and choices. You've done a tremendous job with what you currently have in place for the employees, and again, also being aware of the taxpayer as well. So I just want to commend you for that. First off, I wanted to also tell you about kind of this renewal process with Blue Cross Blue Shield of Tennessee. Obviously, with the COVID-19, the pandemic coming into play, this renewal cycle, contacted our contact at Blue Cross Blue Shield and talked through the renewal before they released it, let them know about all the uncertainty that was going on in the marketplace, and really asked that for the employee's sake, for the county's sake, that Blue Cross consider renewing the plan at the current benefit level and at the current premium. They denied that request and said they were looking at the claims, they were looking at chronic conditions that were going on within the group, and they would have to underwrite it and base it off of that, so they would not, again, just renew the plan as is, again, based on the uncertainty that we're currently in. And so when Blue Cross came back with their original proposal on the renewal, it was a 22.98% increase. They basically talked about that and said it's based on, again, conditions that are in the group. So your chronic conditions that are in the group, as well as the medications that are tied to those conditions. And so when they were forecasting their claims, they were saying they deserved a 22.98% increase. Obviously, I've worked with the county for a long time. That's not going to work. We put that immediately out to bid when we received that. So we shopped it with all the insurance carriers, all the major players. We shopped it with Cigna and Aetna. Both of those carriers declined to quote. They said they were not going to be competitive. United Healthcare responded back to us, and they came in about a 13% increase over current. So again, Blue Cross was at 22.98. United Healthcare came in at 13. The other option, obviously, that we look at every single year is the state health plan. We've always talked about that. We've looked at it from year to year. And so when you look at the state health plan and you compare the three options that the county currently offers against, again, the state plan has 4 particular options, but when you match up as close as possible benefit to benefit, the 3 of the options with the state, it came in at roughly a 1.29% increase. Again, so you have a great option there with going to the state, with transitioning. There's been a lot of talk, obviously, through the years about it. It's great that in a time like this, you do have an option such as the state to go to. And again, this is the local government portion of the state health plan. This is exactly the same benefit that the school system employees have. So it's called local education and local government. It would be the same benefits that the school system employees locally would have. The big thing about the state health plan is you have a huge pool, if you will, with other municipalities, other county governments and school systems participating within that particular pool. I have given you all a spreadsheet. Hopefully you have that in your information. Hopefully you have that in front of you tonight. Just want to make sure you have that. I wanted to kind of walk through the benefits and show you kind of side by side how it stacks up and how it compares to the current premiums that the employees are paying with what the premiums that they will be paying if the county decides to go to the state. You all have that information in front of you.
Yes, that was passed on, John.
Okay, perfect. Thank you. So in the top section, what we've got it broken down into is 3 sections. In the top section, that's your Plan 1. So you have 72 employees currently on Plan 1 with Blue Cross Blue Shield. You can see what the current rates are. You can see what the renewal rates will be. And then you can see what the breakdown of the state plan rates would be. Again, the county funds at a level amount of premium, basically. So the employer contributions are in the column with the green lettering. The employee contributions will be on the far right side in the red letters. And so the county has been funding $557.24 for employee-only coverage. They've been funding $1,000 per month for family coverage. One of the big differences, too, I'll point out there with the state plan will have multiple tiers. Right now, the county has 2 tiers of coverage, employee-only and family. We've looked at it in the past to try to divide that up and do employee-only, employee plus spouse, employee plus children, or full family. And what we had found in the past of looking at that is it just continued to drive the family costs so high. They had to offset that, and it would continue to drive it higher. But the state does have those particular tiers of coverage so that if an employee just wants to cover their children or just wants to cover a spouse, they don't have to pay the full family premium. But if you kind of shift over to the right-hand side of the page, again, in the red column, right now employees on Plan 1, there's 72 of those employees. They're paying $54.95 a month for that individual coverage. The family coverage, again, nobody's participating in that on Plan 1, is $594.73. If we were to renew with Blue Cross on the current plan, they would go from $54.95 for individual coverage to $195.80. If you go to the state health plan on this particular option, it goes from $54.95 a month to $62.76. So it's roughly going up $7.81 a month for an employee, for those 72 employees roughly that are on that particular option. Again, there's nobody taking family coverage on that plan. The benefits, we'll kind of back up a little bit and slide back over to the left-hand side. The benefits, again, are pretty comparable. So right now, the current plan has a $30, when you see those numbers, that 30/50/30, what that means is a $30 office copay to a primary care doctor, $50 to a specialist, The next 30 means 30% co-insurance. That's when someone, after they meet their deductible, Blue Cross kicks in and pays 70%. The member pays 30%. The 3,000 in that option is basically the total individual out of pocket on plan one. The 1,000 is the $1,000 individual deductible. The 10, 45, and 90 are your drug copay tiers. So generic drugs, tier 1, tier 2 is 45, tier 3 would be $90. So you can see with the state plan, it's basically the same copays for your office visit, 30, 50 for specialist. It actually pays a little bit better on the co-insurance, where Blue Cross, the member is going to pay 20%, Blue Cross is going to pay 80%. It has the same $1,000 deductible. It does have a $4,000 out of pocket, so a little bit higher on the out of pocket. But again, your copays, your deductible, even the pharmacy copays are a little bit higher, but it's very comparable to what the county has currently in place. And again, just a very slight increase in cost to the employee. No additional funding for the county. And again, just a slight increase for those 72 individuals on plan one. Let's slide down to the middle of the page and look at plan two. So right now you have 9 individuals that have employee-only coverage on this option. You have 1 individual that has family coverage on this particular plan. If you slide all the way over to the right-hand side, you'll see that the county right now is able to fund, based on how the county provides that $557.24, that falls underneath the premium here. So there's no cost to an employee that wants to have that particular plan for employee-only coverage. That one person that has family coverage is paying $271.99 a month. And so you can see that if you go to the state plan with, again, a comparable option, the employee would still pay nothing per month based on the current county funding, and that one person would go from $271.99 up to $302, so up $30 per month for that person to stay on that particular option. Plan 3 is considered the consumer-driven health plan, or a high deductible health plan. Right now you have 4 individuals on that option. With individual or employee-only coverage, you have 7 that have family coverage. So the majority of people that have family coverage in the county are on this particular plan. So again, you can see based on the current funding, there's no cost to the employee per month for employee-only coverage. There's no cost for the state option on that plan. And if the county continues to fund at that $1,000 for family coverage, right now an employee is paying $135. On the current plan, they would be going to $170, so up $35 a month for the state health plan option. So back just a second on, let's talk about the benefits again on the high deductible plan. So right now on this option 3, it's basically a $3,000 individual deductible, a $5,000 total out of pocket. The new option with the state is a $2,000 individual deductible and a $5,000 out of pocket. So again, a little bit different there, lower deductible on the state plan for just employee only coverage. And so the family deductible would be, I believe it's $4,000 for the family deductible and then $10,000 for the out of pocket. But again, when you look at all these options and you compare the state has another benefit plan that's actually a richer benefit. It has a lower deductible, a lower out of pocket. These were the 3 plans on the state that again matched as close as possible your current offerings. But if an employee wanted to choose that richer benefit option, they would still have that choice as well. Again, there's 4 options to choose from if the county decides to go to the state plan. A few different things to think about with the state and why we're having to meet like this. And again, I just appreciate everyone jumping on so quick and being able to have this special called meeting. Is with the state, they typically need 60 days notice for a group to transition onto the particular plan. So again, we needed to get this done as soon as possible. And they're giving us some leeway there. If they have an answer and get some paperwork about transitioning, they're going to allow us to get that in this week to transition for a July 1st effective date. Again, the state's typically on a calendar year, and I'll talk about that in just a minute in more detail. But couple other things I want to talk about with that. So right now the county is on a fiscal year. It's on a 7-1 plan year through June 30th. And so if the county goes onto the state health plan at this particular time, the way the deductible and the out-of-pocket works for employees right now is it's on a calendar year. So it accumulates, your deductible, your out-of-pocket accumulate on a calendar year, January through December. So that will actually start over. If the county goes to the state, it'll start over July 1, since it's a totally new plan with the state. They won't give any deductible credit. It's just going to have to start over. Since the state plan is typically on a calendar year basis, the county employees will have another renewal period in the fall, and then everything else will start over January 1. Now, going forward, January 1, 2021 and beyond, your deductible, your out-of-pocket, everything will run on that calendar year. But it's just this transitional period that employees that have met deductible so far with the current plan with Blue Cross, that'll start over July 1. That'll go for 6 months. It'll have to start over again for 2021. So that's the one point of emphasis I want to make about some of the employees that already have met some of that deductible, maybe all of that deductible. It will have to start over 7/1. It will also start over 1/1 for the full calendar year and stay on that going forward. Again, we talked about the state needing that 60 days notice. Once you go onto the state plan, they also want a 2-year commitment. So any entity that joins the state has to stay on there for 2 years. Obviously, if you're going on, you're hoping that you're going to stay on there for the long haul. You're hoping to stay on there and not have to come off. It's something you can reevaluate. You just have to do that after a 2-year commitment to being on the state health plan. The one thing we've looked at as well, again, you're looking at a 22.98% increase with Blue Cross. You're looking at a 13% increase with United Healthcare if we were to go that direction, 1.29%. The state will evaluate and send out their new rates for 2021 probably in late May, early June. So you would know if there's going to be an increase to the state rates going into 2021. And so even if it goes up 5, 6, 7%, you're still going to be better off in the long haul. Again, less than that 13% increase or less than obviously the 22.98 if you get an increase going into the 2021 calendar year. So again, just something budget-wise to think about as well. I'm going to stop for a second and address any questions that you may have, again, about the benefits, about the state plan, about where we're at.
John, I had a question. Is the 2-year period, does it start, if we start in July, does the 2 years run till July in 2 years, or is it 2.5 years since they're on a calendar year?
More than likely, Mayor, it's a great question. More than likely, it would be a 2.5 year commitment based on getting on this timing. They may, though, negotiate that and say you could get out if you wanted to, but again, you would kind of be back in that same boat that if you stopped mid-year, you would still have to start deductibles over and everything again on another cycle. So most would continue to go through that full calendar year. So it's probably a 2.5 year commitment, to your point.
John, I had a question also. This is Marie Rice.
Yes.
When we do go to the state plan and we're on it for 2.5 years, and for some reason we decided to come off next year, the following year, or something, when we go back, we'd have to wait 2 years also to sign back up.
Correct. Right. Correct. That's right. I just wanted to also share a little bit of information too, because I saw something that was circulating around the last few days within the county in regards to the state health plan. Again, the state health plan, as you all know, many of y'all have served for several years and been a part of this for several years, some more recent, but we have looked and evaluated the state health plan every year. I've been working with the county since 2007, and so we've evaluated this every year. When I went back and what I saw was assumptions. There were a bunch of numbers floating around based on assumptions. It wasn't based on actual rates, actual premiums. It was based on assumptions. And when you look at the actual premiums, with the county and the actual premiums with the state, when I go back and look at the employee-only premium back in 2012, and I compare that with the employee premium on Plan 1 in 2020, okay, and I average that out, the county's increase over that period of time is a 1.43% increase, okay? When I average the state premiums, and again, this is based on actual numbers. When I average the state plan numbers, it's average about a 2.79% increase per year over that same period of time. So we've always looked at it, we've always evaluated it. We're just now to a point where, again, we would have to increase deductibles, increase co-pays, increase out of pocket to basically get to the point where we're matching and again, being competitive with the state. Again, the state, when you compare it right now, it's still 1.29% more than it was last year. So again, I saw some things floating around saying the county could have saved X. No, when I run the numbers, the county has saved over $671,000 by not participating in the state and having their own plan over this period of time. So I just want to make and cut the record straight that based on actual numbers, that's what the reality is. It's not based on any assumptions. It's based on what the actual premiums are.
Thank you, John. Anybody else have any questions for John?
No, this is Marie again. I just wanted to make a comment. I know over the years, we've talked about different insurance companies and we've, switched around. John's always said if the state's ever lower than the other plans, then, he'd be glad to go with that. And I just appreciate him doing this all these years and appreciate him bringing this to us now and factual information also. Thank you, John.
You're welcome. Thank you.
Yeah.
A couple other things I'll share, and then again, keep it open to questions. The state, when we look at the current dental plan, for example, so the state has its own dental plan, it has a vision plan as well. When I look at the current dental plan that's in place at the county, it's a pretty rich benefit plan. And it when it stacks up really well against the state dental plan. So it's actually your current plan has less premium, has a little bit better benefit. Again, for right now, with the current plan you have in place, no waiting periods per se. The state plan has some waiting periods. I would recommend staying with the current dental plan that you have. Again, it's totally your choice as the county. When I did compare the current vision plan with Blue Cross to the state's vision plan with Davis Vision, that's something else to point out. The numbers that we've looked at, as you all know, it includes the county paying for vision coverage for the employees right now. So it's included in the premiums. That's not the case with the state. It's just a standalone medical premium. They do have a voluntary vision plan through Davis Vision. When I look at the benefits with the Davis Vision plan and the rates, I look at the network of providers. It's a pretty competitive plan. So I would say the county may want to consider going on to and allowing the employees to enroll in a voluntary vision plan through Davis Vision through the state, and employees would enroll in that at the same time they're basically enrolling into the medical plan. So again, that would be another thought there. But yeah, based on where we're at right now with medical, based on the commitment and again, I would at this point, and again, I would recommend obviously the medical plan and also moving toward that vision plan with the state.
What's your recommendations for dental?
With dental, I look at it as how the current plan has a little bit richer benefit, lower cost, great access. I feel like you can go to any dentist. I would recommend, based on, again, comparing it to the state's plan right now, I would recommend staying with Emeritus until you can compare the two and see where the state is truly better than what you currently have in place.
Thomas, if I may, this is Stephen Hendricks. I'm on the state plan for vision, dental, and health. And I think our vision and our health is fantastic, but I am very disappointed with our dental plan and package system. I would highly recommend that this body consider the recommendations by John concerning the dental portion.
Lauren, I also wanted to point out in here with the state, with the group that's looking to come on to the state's plan, they do give counties the option to allow pre-65 retirees to, you basically have to either opt in or opt out. And so it's where the employer would allow pre-65 retirees to continue their health plan again until they turn 65 and become on Medicare. So the retiree in that situation would have to meet the state's eligibility requirements. And so it's documented there within the state documents. I believe I provided to Gina, to the mayor, and maybe in your all's packet of information. But again, this is a simple opt-in or opt-out type situation. It would be where the retiree would basically have to pay the full premium, but again, they would still have access to be on that plan. It's just something that the county would have to decide if you want to opt in at this particular time.
I was going to mention that also. Of course, my wife retired early as a teacher, and that was really made it more retirement an option since we are able to opt in on that insurance. So I think that's a great benefit, along with the extra having the fourth classification on the insurance. Gives our employees more choices. So I just want to mention that also.
Okay, John, do you have anything else for us?
Again, I was just going to say, we're kind of in a situation right now where time is of the essence. Again, the state wanted basically the paperwork. It's called the intent to enroll. They wanted that paperwork completed by May 1st. We've gotten a little window of time where they said, if you can submit that intent to enroll paperwork, they also have a memorandum of understanding. And what that's basically saying is that the county is not going to offer any other type of supplemental plan. They typically call these medical bridge or medical gap plans, where it's helping fund the deductible and the out-of-pocket. I don't believe the county is offering any of those at this time on like a voluntary basis, but you have to complete that. And then again, the opt-in or opt-out for retiree coverage. We'll need to get that paperwork submitted again as soon as possible to the state. They were saying if we could get it by Wednesday, they can assure getting everything set up, getting the enrollment done, getting ID cards out and everything ready to go by July 1st. Again, in this situation, the state requires that the county has basically an agency benefits coordinator. So it's someone that's within the organization that helps coordinate all this. It's not going to be an insurance agent or a broker. It has to be someone within the agency, again, to facilitate everything in regards to the state health plan. I believe Gina Carell will probably be that person there at the county. And so again, everything will flow through her. They'll disseminate information to all the employees here in the coming weeks about the enrollment. So again, I just want to kind of give you an idea of the lay of the land of what that will look like. And again, all the employees, I will say that about the state, knowing school systems that have been on it. I've helped some schools and some counties in the past transition. They do not make exceptions. So when you have deadlines and timelines with the state, they are by the letter of the law. When it comes to enrolling people, you have to make sure that as an employee that you go online or you go through the channels that they provide to you about getting enrolled. Again, they won't make any exceptions. If you miss a deadline, you're not going to have coverage. So I just want to stress that everybody will have to take that responsibility and make sure that they get themselves and their spouse, children enrolled in the plan, again, in that very timely manner within the windows and the parameters that the state sets. But again, once you're on there, again, the state basically handles everything out of Nashville. As Stephen mentioned, he's been on it through higher education. School systems have it. Again, that's the thing the mayor and I talked about when we first got the information. Again, this was just a few days ago. Going to the state plan helps with the volatility of the size of the plan that y'all have right now, just under 100 employees. Now you're into tens of thousands of employees on this plan. So hopefully it'll cut down on the volatility of just ups and downs. So again, I think it's going to be very stable. And again, I think it'll be a good transition for the employees and for the county. But again, I just wanted to kind of emphasize that a lot of that is going to fall back on the employees and also on Gina and some of the folks there in finance, like Karen as well. So just wanted to put that out there.
Thank you, John. This time I'll entertain a motion.
This is Matt Rice. I'd like to make a motion. I would move that we move Unicoi County to the state medical plan, and that we use Davis for vision, and that we keep our current dental plan emeritus, and that we allow our early retiree county employees to opt into the state plan.
I'll second.
Second by John Mosley. Any discussion?
Mr. Chairman, this is Stephen Hendricks. Will we need to look at employer contributions for the other two areas? So the employee children and the employee spouse division line. Currently we have the employee, currently we have the family. Do we need to consider the other two in terms of how much we'll be contributing?
It's a good question. Because this is a special call meeting, I don't know that we can set a contribution. We have to vote on basically just what's on the agenda. And so that's not on the agenda to discuss the contributions, but that is certainly something that we can visit the next meeting. Mayor, do you agree?
I would agree. I think the appropriate time to address that would be in budget talks and discussion as to what the county's going to contribute for individuals or family, or if we have another tier, if that's going to fit, whatever that contribution on the county level would be discussed on the in budget. That's the way I would see it.
Okay.
The numbers that John Manful presented, I think it was based on leaving those contributions the same. Is that correct, John?
Yes, that's correct, Matt.
The only difference in that is there's two tiers with our current insurance, and there's 4 tiers if you go to the state plan.
I see. Yes.
Also, we've got to consider our health savings plan, for the high deductible. In the past, when we have worked on the insurance or trying to decide on insurance coverage, it's hard for the employees sometimes to pick or choose which they're going to go with if they don't know what the county's contributing.
That was going to be my question, is how is the employees going to know between now and the time that you all discuss this through the budget process, what they're going to pay, what's going to come out of their paychecks? What am I going to tell my employees?
And I believe that would only affect the people that have family coverage, is what it looks like. That would only impact someone that wants to cover a spouse or cover children versus covering the full family. I mean, it looks like the county's locked in at the current $557.24. It just is going to have to be determined if the county is going to fund the full cost or up to that $1,000 for somebody that has a different employee plus spouse, child, or full family.
So, John, what is the deadline again for when the employees need to be enrolled?
The state will actually they'll have to determine what those dates are. They will have to provide that information back to Gina and back to the mayor of when they will actually conduct the enrollment meetings.
So we've got some time. If we could schedule a budget meeting with Stephen and look at those numbers before the enrollment deadline.
Yes.
Okay.
Yes. Because typically I would think, Lauren, that they would probably be looking at a June 1st, have the month of June basically to get everything processed and get set up in their system. But again, they will have to determine that, but that would be my assumption. So you probably will have a few weeks to make that decision.
All right, Stephen, if you'll make note of that.
So noted.
I would, if I was an employee of the county and interested in signing up for family insurance, I don't think I would sign up for it without knowing what the county was contributing. So that's something we need to nail down before the enrollment deadline. Okay, is there any further discussion?
I just had one other question. Does this include the ambulance service employees, or will they be included in this plan?
Marie, this is John. It does. When we were looking at all the information, we submitted all the potential and that particular division's employees that will be working with the county. So we put them also under that umbrella. I worked with Adam Copas on that, and so we got that information out there.
Very good. I just wanted to be sure.
They've been given that information, and of course, they will be budgeting for their employees. They're just piggybacking off the county's insurance because premiums and pool size and everything was financially was a lot better, and the benefits were a lot better using piggybacking off the county employee policy, or not employee policy, but insurance policy. So that's been provided to Adam. As soon as I got it, I provided that to Adam, and they're scheduled to discuss that also.
Any further discussion or comments?
One more question for the mayor. Is this going to be, I know it's going to put a lot more workload probably on Gina, especially at first. You know, it's going to be a trial run here with this. Is she, you know, time-wise, is she going to have that time to devote to this?
I've discussed that with Ms. Correll, and we feel like she can be do the administration work. She's doing a lot of that now, except for questions and have to get with John or with the agent. So she's been handling a lot, you know, some of that duties now. I think the initial enrollment period will be time consuming, but we're willing to pick up. I think she's willing, and my office is willing to pick up that time consumption on getting the proper paper and getting everyone enrolled. Once we get everyone enrolled, you know, we should be okay.
Thank you, Mayor. And John, again, I want to thank you. We appreciate you for all these years.
Marie, thank you, and you're welcome. It's been a privilege to serve the county in this capacity. And again, as a taxpayer, a citizen, I want to do what's best for the employees and the taxpayers. So it's been a privilege working with you on this. And I shared with the mayor too, and Ms. Correll, that I'll be glad to help any way I can with the transition and make that as smooth as possible as well. So whatever I can do to help, I'll be glad to.
Thank you, John.
Yeah, John, we really appreciate all your work over the years.
Well, thank you, Lauren.
All right, this time I'll ask Mrs. Bowen if she will to please call the roll.
So I've got a question first.
I'm sorry, go ahead.
That's okay. So as we go on this state plan, John will no longer be our advisor with our health insurance. If we have an issue or a problem with something that comes up with the insurance, will go through Gina now. Is that what I'm understanding?
Yes.
Okay. And she will be able to help us with everything. John's been so good with us throughout the years as far as taking care of us if we've ever had a problem. That's a lot of work. That's a lot of work on Gina, I know.
And I think she'll have some resources there at the state as well to assist, and she'll have the customer service and the contact information to make sure she gets out to the employees. So I'm sure she'll be able to help the employees navigate through that process.
Is it as easy as far as when we have an issue with, like we've had with the other providers? Is it as easy with them? Will it be as easy as with them, I guess, is what I'm asking.
Again, you'll still have top level customer service. I feel like, again, because it's Blue Cross. And again, with this plan, you can choose between Blue Cross or Cigna at the same price. Again, I think everybody's very familiar, obviously, with Blue Cross, but I think you'll have a very good customer service experience with them. I don't think you'll have any problems with that. It may be a little bit different than having somebody's cell number to call and assist with that and be an advocate, but again, you'll still have good advocacy there through customers.
Well, I want to thank you also, John. Throughout the years, we've worked a long time together, and I appreciate everything that you've done for, all the employees and helping us out.
You're welcome, Mitzi. Thank you.
All right, if there's nothing else, Ms. Bowen, when you're ready.
Can you hear me?
Yeah.
Okay. Stephen Hendricks,
Yes.
Marie Rice,
Yes.
John Mosley,
Yes.
Matthew Rice,
Yes.
Jamie Harris,
Yes.
Jason Harris,
Yes.
Lauren Thomas.
Yes.
7 yes, 2 absent, motion carries.
Thank you, Ms. Bowen. And John, again, thank you for all your years of work and service to our county. We really appreciate it. And
Absolutely.
with that, I'll
Yes.
entertain a motion to adjourn.
I'll make a motion to adjourn.
Have a second.
Second, Stephen Hendricks.
Thank you. All in favor, say aye.
Aye.
Aye. Thank you all.
Thank
We
you.
stand
Thanks,
adjourned.
everybody.
Have a good night.
Thank you. Thank you, John.
Bye.
Thanks, John.
Thank you.
Thank you.